Hello, I'm Dr. Troy Harris, podiatrist in Jacksonville, Florida. I want to talk to you today about bunion surgery. 3 things about bunion surgery. Number 1, should you have bunion surgery? Number 2, what type of bunion surgery to have? And number 3, what's the best way to recover from the bunion surgery? So number 1, should you have bunion surgery? A lot of patients have this question, and I believe that it comes down to the level of pain that the patient experiences. If the patient has significant pain from bunion surgery and they feel like it's a significant hindrance to their quality of life, and basically they just feel like they're done with the bunion, they can't live with it anymore, that is the best time to have bunion surgery. I gauge success of bunion surgeries when I perform them by one thing. I call the patient 1 year after the surgery and say, "Are you glad you had this surgery?" And obviously we're looking for a yes there. And I have found that people are more likely to say yes if they're in significant pain prior to the bunion surgery. Patients that are on the fence and they're not sure whether they should have surgery or not, or maybe they just don't like the looks of the deformity, or they're worried that it may turn into a problem years down the road and they want to go ahead and fix it now. Those type of patients I find are more likely to say no, regret having this bunion surgery. So the next thing I want to cover is what type of bunion surgery to have. And I'm going to use my foot model for this. So looking from the patient's perspective, bunion surgeries, generally speaking, I'll categorize these into 2 types. One type of bunion surgery is done at the head of the first metatarsal. So this is the first metatarsal bone, this is the head, this is the base. And the deformity that you have with the bunion is this bone turns this way, the big toe curls in this way, and then the bump here is what is typically painful for patients. So with the head procedure, the bump is shaved off, and then the bone here at the head is transected, and the head of that bone is shifted this way, which brings this toe from this deformity more to a straightened area. And like we said, the surgeon shaves off the bump. That is by far the most common type of bunion surgery that's performed. It's known as a chevron or an Austin bunionectomy. There are other variants that are done at the head. And that surgery is a faster recovery, probably less chance of complications, and it's easier for the surgeon to perform. And I think those are the main reasons why this one is most frequently done. The problem potentially with this surgery is sometimes the deformity can recur. So down the road, that toe can start curling or turning in again, and then this bone continues to curve out this way. The original place, or what we call the apex of the deformity, what these bunions arise from, is not here. It's actually back here at the base. So it's the alignment at the base of the bone that causes this bone to jut out this way. So the base procedures, also probably the most commonly performed, is called a lapidus procedure. And a lapidus procedure, if performed correctly, even though it's much more technically difficult for the surgeon to do than the head procedure, it's going to result in probably more correction and a more long-lasting surgical correction. So whichever procedure is done, there's also a choice of how to fixate the bone. So those 2 bones that are here, the bone cut that's done here, back here, the fusion that's done at this joint, those 2 bones at the location of the bone cut have to be joined back together. And typically either a plate with screws is placed over the top of the 2 bones with screws going down to hold those bones in place, or a screw may be placed across the 2 bones. So for example, the lapidus procedure, these 2 bones here are fused and a screw is placed in the operating room across those 2 bones. I use a different technique. I use a memory staple. And a memory staple is placed on the top of the crossing over these 2 bones, and the staple has a form just like a staple you've seen. It has 2 legs sticking down from the staple. In the memory staple, those 2 legs have a memory within the metal of the staple to pull together. So there's an instrument to straighten the legs, They go down into the bones, the two bones, and then once that staple is implanted across those two bones, those two staple legs actively pull together. And those staple legs are going to continue to pull together even after the patient leaves the operating room a week, 2 weeks, a month, 2 months after the surgical procedure. Those two staple legs are still pulling together, actively compressing those two bones that we want to fuse together. So, in my opinion, this is a better way to perform fusion of two bones with bunion surgery, whether it be at the base or the head, because when a screw is used to compress these two bones, the last turn of the screw in the operating room is the last active compression that there will ever be to pull those two bones together. And as the bone fuses and heals after surgery for 4 weeks, on into 6 weeks, even a month or two down the road, those two bones, as they fuse together, are going to remodel, and there's going to be some resorption of bone at that fusion site. And it's nice, it's really helpful for those two staple legs to pull those bones together actively while the bone heals. The third thing I want to talk about today is the recovery from bunion surgery. Walking on a foot that's had surgery is not a good combination. And it's a problem for patients because they have a life to live, they want to go back to work. So surgeons put the patients in a boot or a shoe. But I tell my patients, let's plan ahead and let's plan 2 weeks where you can take off from work and be home and rest on your back for 2 full weeks after the surgery. The reason for this is if you have bunion surgery and your foot is down towards the ground, it's not elevated to heart level, the foot is going to swell, the foot will probably hurt more compared to the foot being elevated. And then on top of that, if you start walking on the foot during the recovery process, especially that first 1 to 2 weeks, chances are likely that that foot's going to hurt more, it's going to be loaded more than it's ready for, it's going to swell, and it'll probably turn somewhat pink or even red. And that's going to cause the patient to be in pain. They're going to call the doctor and say, well, my foot's red, it's swollen, it's painful, and the doctor's going to need to prescribe them more pain pills, possibly narcotics, possibly put the patient on antibiotics. And the foot was just overloaded and had more activity than the tissues are ready for. And I found that elevating the foot to heart level or a little bit above the heart level for those first 2 weeks after surgery makes a tremendous difference. Less complications, less chance of infection, less need for pain pills. My patients typically will take a pain pill on the night of surgery. It may be the next night, but that's usually it. After that, my patients usually are off of the narcotics, and they may have a need for medication like Tylenol after that, but typically they don't. After those first 2 nights, if they stay off the foot for those 2 weeks, then they do very well. They're still allowed to get up and go to the bathroom and eat, but it makes a tremendous difference how that recovery period from bunion surgery is handled. Thank you for watching. I'm Dr. Troy Harris in Jacksonville, Florida.